Bienvenidos, mis queridos televidentes, a Esperanza en su éxito, otro segmento más de la información latina para nuestra comunidad latina. Hoy en día tenemos a la directora regional de los Estados Unidos, que ella representa el servicio social y la salud. Ella es la persona regional de donde está establecido aquí en Boston. So, hello, Christie. El nombre de ella se llama Christie Hager. ¿Cómo estás, Christie? How are you?
Bien, gracias.
Oh, qué bien, qué bien. Christie no habla español, so vamos a hacer este programa en inglés, pero después lo podemos traducirles a ustedes por medio de las cámaras. Christie, how are you? I'm so glad that you are here today with us to inform us and educate us about what's going on with medical health and the Medicaid and everything that we need to learn as a Latino community and what we need to know so we can make the right decisions. So welcome and thank you.
Thank you very much, Esperanza. It really is a pleasure for me to be able to talk to you today about the many benefits for all Americans and particularly for Latinos under the new federal health reform law that was passed by Congress in March of 2010 and signed by President Obama, and has meant so many benefits for so many Latinos for the last more than almost 3 years. Right now, particularly, we're celebrating Hispanic Heritage Month, so this is a chance for us to focus on what those benefits are for our Latino residents and clients and patients and neighbors and friends and family. And I'm excited also that we're approaching the period of annual open enrollment for people who are beneficiaries of the Medicare program, for people 65 and older and some disabled who receive benefits in that program. Once a year you have a chance to change your coverage or to examine your coverage to see if there's a better plan that suits your health needs. So that's very timely information. That open enrollment period starts October 15th and goes till December 7th. It's a particularly perfect time to talk about all of the benefits under the federal health reform law, the Affordable Care Act, as we also call it, for Latinos.
Wonderful. So tell me, Christie, how does this medical act or health act will affect the Latino population, Latino families, Latino parents, Latino children? This is so important to us because we want to know how can Esperanza en su éxito bring the right and the proper information to the community, to the Latino community.
Well, first I'll describe a little bit about coverage, health insurance coverage and access to care for Latinos nationwide. We know that nationwide about 1 in 3 Latinos have no health insurance. And about 1 in 2 Latinos don't have access to regular sources of medical care. That's unacceptable.
Right.
Part of what the Affordable Care Act does is to expand access to coverage so that more people, and particularly with a focus on those who have been most vulnerable to lack of insurance or lack of access to care, even if they have insurance.
And when we talk about people being affected, who do you think affects more within the group of the Latino community?
The Affordable Care Act has provisions that really impact and improve care, health insurance coverage, and access to health care throughout the lifespan. So we're not talking only about beneficiaries of the Medicare program, who are those who are 65 and over and some disabled. We're also talking about people who aren't yet old enough for Medicare, but who will have new opportunities for access to coverage. And we're talking about women and families. We're talking about women, pregnant women, keeping them healthy and their babies healthy.
And elementary school children who also need to be healthy, right? That is so important to help the kids also to get some benefits, some medical benefits too.
That's right. So in addition to strengthening the Medicare program and making it stronger than ever. In addition to that, there's also, under the Affordable Care Act, a new investment in preventive services and public health. So the idea of investing in care to keep you well before you get sick.
Right.
Part of that includes very important services, preventive services we call them, like screening tests for mammography, screening colonoscopy, an annual wellness visit for our Medicare beneficiaries, but also preventive services for children under some private health insurance coverage as well. And that is all with the idea of keeping you well before you get sick.
Right.
We know the value of that investment.
Right. So it's preventing before we're lamenting, right?
That's right. That's right.
That's what we're trying to prevent a problem from happening,
That's right.
serious problem from
That's
happening. Talk about the elderly population, the Medicare. What can you talk to us about that? What kind of information would you want to distribute to the Latino community?
So I mentioned already that we're approaching the period once a year when we call it open enrollment. So
right.
for people who are covered under Medicare program, they have a chance once a year to do what we call a checkup on their own Medicare coverage, to make sure that the plan they have, whether it's traditional Medicare or a Medicare Advantage plan, which is another type of coverage, or a prescription drug plan, to make sure that's the right coverage for them going forward into the next year. Have their health needs changed over the past year, or their prescription drug needs changed over the past year? Or do they anticipate changes in the coming year?
Christie, what about the premiums? Can you talk to me a little bit about the premiums and outside pocket expenses?
Yes. One thing that's important, and this again is thanks to the Affordable Care Act, it is strengthening the Medicare program. It's providing these historic, for the first time, preventive services that will be provided with no more out-of-pocket costs for Medicare beneficiaries. So depending on the type of Medicare coverage you get, you would be entitled to access a screening mammography, screening colonoscopy, what we call an annual wellness visit, for you to sit with your provider to discuss how you can live a healthier lifestyle. Those will be provided for certain Medicare beneficiaries with no out-of-pocket costs, no copay, no deductible, and as I always say, no excuses. We want to make sure people know these benefits are available to them and that they use them. And we already know that just in last year, 2011 alone, hundreds of thousands of Medicare beneficiaries in Massachusetts accessed at least one of those now free preventive services.
That is so wonderful, because as you well know, the Worcester area is very needy in terms of the Latino community, and there sometimes families do not have enough money to buy medication, or they're afraid to go to a doctor because they're afraid that they're going to pay a big bill, and they don't understand how to work around it. And now that we have this service or this new health act, that would be so beneficial for the Latino community.
Yeah. So for seniors and disabled who are in the Medicare program, it's very important for them to know that this open enrollment period starts October 15th, and they have until December 7th to decide whether they want to change their coverage for the next year. Many people may decide to stick with the coverage they have, that it's worked well for them and that there isn't a better plan for them based on what their needs are or what they expect they'll need for the coming year. But it's important for them to be able to review the coverage they have. These books, Medicare and You, one is being mailed to each household where a person who's on Medicare lives. This is a very valuable reference book during this open enrollment period and really throughout the year. It lists all the plans available, and people should know that their local senior center has counselors. We call them SHINE counselors. It stands for Serving the Health Information Needs of the Elderly. And they are located at every neighborhood senior center, and they are there to do one-on-one counseling with people about reviewing what their coverage is, what they think they may need for the next year, and to make sure there isn't an even better plan for them that would offer lower costs, and to let them know what their choices are.
And that's another thing that the Latino community is so concerned about, is whether or not they can afford the service, the medical services. Many Latinos are unemployed, and unfortunately they used to guess, what do I pay first, my medication or the heat, or whatever it is, and it gives them an opportunity for them to be healthy, for them to not spend so much money on the plan, on the medical plan. It's affordable.
That's right. So, and we know that there shouldn't have to be a choice between accessing care, even care that's preventive in nature, that you're accessing when you're well before you really become sick. And there shouldn't have to be a choice between purchasing those things that we know are so essential, groceries, food, heat.
Now that the winter
housing,
is coming.
That's right.
Yeah.
There shouldn't have to be a need to choose between that and valuable and needed health care and prescription drugs as well that people need for different chronic health conditions. We also know Latinos suffer from different chronic health conditions like diabetes, high blood pressure, more than whites. So that's another example. We'll talk a little bit later about how the disparities between the health of Latinos and others can be so different, and what we can do under this new health reform law to improve that. But particularly in the Medicare program, one of the examples of another benefit and another way the program is strengthened is that there's discounts and reductions in costs to people on Medicare of prescription drugs. So in the first year after the law was passed, in 2010, people who hit what we call the donut hole, or the gap in coverage for prescription drugs, you spend a certain amount and then there's a gap in that coverage, and any drugs that are purchased, prescription drugs, need to be paid for out of pocket until you reach another larger amount, and the coverage kicks in again at a catastrophic level. That is different now. So in the first year, those who hit that donut hole were protected from that somewhat. It's starting to close. The first year they got a one-time rebate check when they hit the donut hole. It didn't cover all the coverage. But as we go through to the year 2020, the donut hole is closing each year, a little bit more each year. So this year, there are discounts of about 50% of brand name drugs when you hit that gap in coverage, or that donut hole. And also some discounts for generic drugs as well, not as high as the amount for brand name, but for brand name and generic drugs in that donut hole, there are discounts. And eventually that whole donut hole close, and by 2020 it's gone completely. So there will never be any gap in coverage, and coverage will be continuous. That's another important benefit of the health reform law. And we know that in Massachusetts, among all Medicare beneficiaries, over 120,000 of them to date have saved an average of $600 each in their prescription drug costs, for a total of $76 million.
Wow.
That's just in Massachusetts. And we see this all throughout the country. That is an exciting, valuable, critical new benefit for people in the Medicare program.
That is exciting. Especially when, again, we're dealing with poverty. We're dealing with a lot of children, families, women that they don't understand how to work the system. And that's why we have you here today, Christie, because it is so important to clarify the information, so all of us know what is this all about. The language should not be a barrier when it comes to health care and when it comes to your family well-being.
That's right. I'll also mention that one of the other areas of benefits in the health reform law, and this is for people of all ages, is an investment in community health centers. So those health centers that are located in neighborhoods, on the streets closer to where people live, and there are several in the Worcester area alone, is a significant investment in allowing those places to really grow and expand, to be able to treat more people, to provide for them the preventive care, the primary care, the place where they can go for checkups and routine care,
Right.
And to be diagnosed if they need to be,
Right.
for specialty care that they
Right.
get referred to elsewhere. So that's another benefit, huge benefit for people in neighborhoods, community health centers being located closer to where they live and work.
Christie, I personally have witnessed how the healthcare in the community has helped, the clinics have helped not only Latinos or Latino families or Arabic families, or but the whole community. It's so wonderful to have the clinics right into the schools or in the community per se, right there, because it becomes a part of the community. It becomes a tool in which the family walks in with their kids or their parents, and they feel that they're welcome. They feel that that they don't have to be afraid, that they can ask all sorts of questions, and they're gonna be respected, and they're gonna be given everything that they need to make a wise decision in regards of their health.
That's right.
I have witnessed it myself. It's an amazing service. It's an amazing way of reaching and healing our community.
Yes. And part of the value of the new federal health reform law is that it now invests new resources directly from the federal government into those communities and neighborhood and community health centers, allowing them to provide the infrastructure to provide care to more people who we hope have insurance. And for them to be able to access, like I said, and like you've mentioned, the value of the routine care, and the annual vaccinations.
preventative services. Because one of the things that I have observed in our Latino community, which worries me so much, is the obesity with children. I work in an elementary school, just like what I told you earlier. And I see children that they're eating junk food and they're eating things that they shouldn't be eating. But these clinics and the nurse practitioner and the nurses at the schools, they work together so we can educate our children, and not only our children, but also our parents, to learn how to make the right decision. And that is so exciting when I walk into a room and I see parents, nurses, doctors, children, teachers working together so we can overcome that problem that has assaulted the Latino community and all the poor communities that they could not afford preventative services before, like education, like
That's right.
Eating well, learning how to eat well.
That's right. That's right. And we have worked at the Department of Health and Human Services, the U.S. Department of Health and Human Services. We've worked a lot on improving physical activity and nutrition for children, and to encourage communities and schools to offer more healthy food choices. First Lady Michelle Obama's program, Let's Move, has been a program where we've been able to work very closely with cities and towns on how to improve those that education for children and for their families.
Right.
We know children will take that information they learn in school and bring it home.
And the information trickles down from the parents, from the nurses to the parents, to the kids, and that is an amazing synergy. The information goes around and it really heals people. It really heals people and educates people, and I think that's a wonderful thing. That's a wonderful thing. If there are a message that you want to bring to the Latino community, what would be that message? What would be those things that you want to tell my Latino people through this television show, what would it be, Christie?
I would want to make sure that your audience understands that there are so many new benefits of the Affordable Care Act that build on the infrastructure of care and access to coverage that we've had here in Massachusetts, that there are benefits available to them, that we want to make sure they know those resources exist in their community. The community health centers that provide that preventive care and routine care. Now for those people who are enrolled in the Medicare program or who are ready to enroll in the Medicare program, these counselors available at their local senior centers who can really help review with them the benefits that are available to them under this federal law as well. And also, there are other benefits for people who are with private insurance, but the message really is, this is for everyone. This is for seniors, the disabled, this is for all of the members of the family. This is about you, your friends, your neighbors, and as you find out information about benefits that are available and how we really are working so hard to keep you well, share that information. Share it with your friends, your family, and your neighbors.
Can we get literature in different languages? If we wanted to distribute the literature
Yes.
in the schools or in the health clinics, or is there in different languages like Spanish, Arabic, French? Can we do we get that?
We have educational materials in several different languages.
Wonderful.
Certainly we have a lot in Spanish language. We have a website that is called healthcare.gov, and it's translated into cuidadodesalud.gov.
Cuidado de salud. That's wonderful.
That's right, and it's a great resource for a lot of information.
And the information there is very helpful in terms of the steps to take in order to receive the services, the preventative services, because that's what I'm looking for. I'm looking to serve my Latino community to prevent things from happening. And I think that education is very important when it comes to prevent things from happening.
Yes,
Yeah.
that's right. And speaking of preventive care, it's also important to remind people that this is, we have flu season coming up. So this is a time to be reminded. Make sure you get your flu shot. There are flu shots available, certainly when you go to wherever your healthcare provider's office is, excuse me, and also at many neighborhood pharmacies.
Yeah. Why is it so important that we have to get a flu shot?
Well, it's the nature of preventive services. So this is taking measures to keep yourself well before you get sick. We know how protective it is to your health during flu season, and for those around you to be immunized.
Is there anything else that you would like to say in front of the camera for Esperanza en su éxito to the Latino community?
Just again to repeat, keep in mind that Medicare open enrollment is coming up. It's also a time to remind folks, keep your Medicare number private and close to you, and don't give it away over the phone. Don't give it to someone who knocks on your door. Anybody who gets your Medicare number can bill the Medicare program fraudulently, and we want to keep that money to spend on patient care.
Right.
And also that this federal health reform law now gives us all kinds of new tools to expand people's access to coverage and to make sure that those Latinos whom we know either don't have health insurance or don't have a regular source of care will now have new ways to have that.
Which is a wonderful thing. Christie, thank you so much. Thank you for coming into this program. Thank you for sharing with us all that information that is so essential for people, for the Latino community to make the right decision. Thank you so much for being here with us. Y amigos, mis amigos televidentes, esto es algo tan importante para todos nosotros. Acuérdense que la salud es lo más importante que nosotros tenemos y es mejor prevenir que lamentar. Así que gracias por tenernos en sus corazones y en sus hogares, y gracias por tener este programa Esperanza en su éxito en sus televisiones. Buenas noches y que Dios me los bendiga a todos ustedes. Gracias.